Hello, I'm Malachi Winters, paramedic instructor for Cali College. Today we're here to talk about bath salts, the new street drug that has been going around. So what are bath salts? We need to be clear that these are not Epsom salts, which we traditionally think of as being the stuff that you mix with your bath to have a nice smell when you're taking a bath. These are chemical stimulants that are marketed as bath salts or as plant food. The primary ingredient in bath salts is methyl N-dioxypyrovalerone, or MDPV. There is also mephedrone and methylone, which are very similar compounds that can be created by street chemists. While these compounds are marketed as bath salts and plant food and sold in head shops and convenience stores, marketed names are Ivory Wave, Purple Wave, Vanilla Sky, Bliss, Bolivian Bath, Easy Plant Stem, and mephedrone plant food. Remember, though, that the primary purpose that people buy these is not for the labeled use, but to ingest and get a high from. Here's some examples of the packaging that the bath salts come in. This is an outer foil packaging that holds an inner Ziploc bag that contains the crystals. Here we have on the left Vanilla Sky, and on the right Ivory Wave as the packaging. And on the inside of the packaging, there will be a little Ziploc baggie containing crystalline powder. And as stated before, the other marketed purpose besides bath salts is plant food or pest control for plants. Here are some examples of that. Now, are bath salts legal? Well, up until very recently, they were 100% legal because it was marketed as not for human consumption, and the manufacturers of the bath salts were able to get around FDA guidelines. But since this is such a significant problem, on September 7th, 2011, the DEA invoked its emergency scheduling authority to temporarily control 3 synthetic stimulants. And those include mephedrone, methylone, and MDPV. Restriction of the sales went into effect on October 7th, 2011, which was like 2 days ago, and will be in effect for 12 months until further research is done and the decision is made whether or not these substances will be considered Schedule 1 drugs. Chances are they probably will be considered Schedule 1 drugs, which will fall under the same category as LSD, heroin, and ecstasy. That's probably not going to stop the presence of them on the streets, so we still need to be aware of them. Well, how are the bath salts consumed? Well, since they are a crystalline powder, they can be snorted just like cocaine and methamphetamines. Oral ingestion has also been used. The user wraps the crystalline powder in paper and then swallows the whole paper. This is called bombing. These substances can be smoked, and there are also documented instances of people taking rectal enemas with the salts mixed in. The effects of bath salts are going to be very similar to methamphetamine, cocaine, and ecstasy. So you're going to have that sympathomimetic effect of increased energy, insomnia, jitteriness, hypertension, tachycardia, and dilated pupils, and also, particularly at the lower doses, a sense of euphoria. One of the things that these bath salts presents with is a strong urge to repeat dosing. So the users will take dose after dose after dose, and then we start getting into the similar effects that you would see with cocaine and methamphetamine overdoses, with hallucinations, psychosis, delusions, paranoia. There's quite a few instances of documented self-mutilation and a definite increase in suicidal behavior. And these patients are also at high risk for excited delirium. So now let's talk about the management of the user that has bath salt intoxication. First and foremost, always is your own personal safety and scene safety. Remember that these patients are prone to violent outbursts, and treat them as if this was a cocaine or methamphetamine overdose. Be aware that there's that possibility of superhuman strength. For most of the cases, you're going to treat them symptomatically, keep them calm, reduce stimuli. but we're going to want to keep a close eye on the patient's body temperature and their vital signs, in particular their heart rate and blood pressure. Any increase in body temperature means that the patient is very close to that excited delirium state and starting to get into that area, and that once they're in excited delirium, there is a very high chance of sudden cardiac death. When we are getting into that stage of psychosis, chemical restraint by far is the preferred method. And the state of Maine actually has a bath salt epidemic right now, and they pretty much go to chemical restraint using a benzodiazepine and an antipsychotic as their first line treatment for treatment of the bath salt intoxication. And here are some resources for you. And it's about 5 different articles culled from different areas of the internet. If you're interested in looking at some additional research or additional reading on this topic. Thanks for paying attention, and we hope that you have a good day.